Okay, sciatica is the name given for patients who have leg pain, okay, which radiates from the back. And there's lots of different causes of sciatica, but the most commonest cause of sciatica is due to a herniated disc or a disc prolapse or a disc protrusion or a slipped disc. There's lots of different terminology, but they all pretty much mean the same thing. It can be quite painful. A lot of people get sciatica. I've had sciatica, and it's settled down. And most sciatica do not require any major intervention. But what triggers it is actually this natural degeneration of the disc as people get older. Okay, and degeneration starts from a young age onwards. Believe it or not, people don't realize that it can occur from like 15, 16 onwards, and as you get older. And the most commonest age group is between like 20 to 40 or age group. If you look at the spectrum of this, and as this starts degenerating, it's basically like a worn tire. A worn tire, if it gets a puncture, it will the disc material inside pops out. Okay. The question is that a lot of people say, "Oh, I lifted this, or I did this, or I pushed this, or I picked my child up." And that's what triggered it, or I was in the gym. Actually, that's not true. Any event would have triggered it, but it's quite natural of human nature to look for a cause, or maybe say I shouldn't have gone to the gym, or I shouldn't have lifted that. That's not true. All those kind of loads are what we call normal physiological load. They're not really excessive loads. Picking up your child and things like that, or a light object, or bending forward, that's normal physiological movement. Okay, often that triggers it. Okay, and so it's actually just normal age degeneration, and it can happen to anybody at any time. Really, you can't really prevent natural degeneration of the disc, and that's predetermined there. But fortunately, most cases settle down, and most cases do not require any major intervention there. Okay, this is an interesting one. Okay. My recommendation for that is, if you're getting acute bowel sciatica, is probably go and see a professional regarding that, and that will be like usually a physiotherapist or a chiropractor, osteopath. Okay, and they'll see you and assess you. Okay, and what they tend to do is the objective is they will take a history and examination to make sure there's no serious pathology going on. Okay, and then what they will do is, if they diagnose you've got disc sciatica, and again, most people with leg pain, which goes down into usually the calf of the foot, okay, they have sciatica, and it's due to a disc prolapse. And what you find with this, and a classic symptom of sciatica, is when you're bending forward or sitting down, okay, they get more leg pain. Okay, that's because when you sit down or bend forward, the spine flexes, and that pushes the disc out at the back, trapping on the nerve. Okay, so in theory, is what the exercise is you want to extend your back. Okay, and you can either do it from a sitting position, or in a standing position, and just do light extensions on your back, focused on your lumbar spine, or you can do it in a lying down position on your front, and you can do gentle back exercises. You can do that every 10 or 15 repetitions every few hours or so, if it's not too painful, and usually that will improve your sciatica symptoms over a few days to a few weeks or so. And that's what I see a lot of physiotherapists doing on that. And you can look on that, and you can see. I recommend to see a physiotherapist or a professional regarding that to guide you, or you can look online and look for back exercises for sciatica, and that will demonstrate that. There's numerous videos on that there. Okay, the medical treatment option is when a lot of people get sciatica initially, they get severe back pain and they often leg pain. Okay, what you don't want to do in that instance is you don't want to start push through it. Okay, you want to take initially a few days rest and let it just calm down, because the analogy that I give is like if you're running and you sprain and you pull your calf muscle, okay, you can't carry on running. Okay, what you have to rest a little bit. Okay, when after a few days of rest, the calf muscle heals itself, then you can start running again. The same with that. In the initial phase of back pain and particularly sciatica, you want to initially rest. It can be too painful to to do any kind of physical therapy exercises. So initially rest, anti-inflammatories and good pain relief, and avoid positions which aggravate the sciatica pain. Okay, if it's sitting down aggravates it, or bending forward, don't do that. Avoid sitting down. Just lie down and lie in a position where there's no pain. And the less kind of hits you have on the sciatic nerve, the more chance it will heal. Okay, so that's initially rest and analgesia, and then you can have other medical options. There are some other painkillers. I recommend patients seeing their GP about that, but there is a range of painkillers which can be from paracetamol, codeine, tramadol, anti-inflammatories such as ibuprofen, naproxen, or Voltarol, and then you can have like amitriptyline, gabapentin, pregabalin, or oral medication that can help when patients have sciatica here. Again, with the sciatica, a lot of people they improve significantly on that. Okay, it's a difficult question to answer. That we don't, although we would like quick treatment. Okay, but it varies in individuals. Okay, you want to try and avoid surgery unless you really have to. Okay, I mean, surgery. I'm a surgeon. I love to operate. Okay, but there are some downsides with surgery, and it's not always the cure. Okay, you know, with any kind of intervention, it varies on an individual. We can't really predict how quickly they're going to improve. A lot of people have sciatica, it improves quite quickly with painkillers and physiotherapy within a couple of weeks or so. Okay, and then they settle down. It might take a bit longer, but even if you have surgery, okay, often the pain goes away quite quickly. But don't forget, you got a recuperation period maybe about 6 weeks or so. 2 weeks to the wound heal, 6 weeks before you're back to pretty much full fitness or so. So the length of time is we don't really discuss on that. Well, we do, but what we're saying, we give the options of the patients to decide what they want to do on that. Okay, but what we also I didn't note to the patient is tell the patient is that there is a recurrence of this. Okay, whether you do like a steroid injection or an operation or conservative measure, there is a chance of relapse. With some looking at 5 or 10% chance of relapse there. So in the treatment of sciatica, the intervention is a short-term fix to get you back in mobility, but in the long term, you can still have recurrences there. Okay, sciatica. The objective of sciatica, a lot of research is done about this and the outcome scores. Okay, we have the British Spine Registry that we use. Our data is inputted in there. Okay, and a lot of surgeons do that. And what we have, there's been a collaborated evidence of the outcomes of people with sciatica, which is good because we know what the future kind of holds on that. Okay, a lot of people get good results. Okay, and our objective is not to cure. What we say is the pain will go away, cure it completely. Is what we say is people have with the treatment of sciatica is to improve their symptoms, to have a significant improvement in their pain, to have a much better quality of life. Okay, so if we look at the National Spine Registry scores, what this shows is that the people who are treated with sciatica, particularly with an operation or so, okay, and we only do an operation if other options have not really worked, or the patients don't want other options, is a lot of people have they have a residual amount of pain, but actually they can live with that. Okay, and they function pretty well with that there. Okay, but and most people have a little bit of pain, but actually they're fine with that. And some people have completely pain-free. Okay, but the majority of people have a significant improvement in their pain, where they have they are having much better quality of life than they were before.